I just got this paper in the mail from Get Covered Illinois because Obamacare is being taken away and insurance is changing. Now you got to get it through the state, yada, yada. The insurance that I pay for right now is $75 a month, which is already a stretch for me because I'm a grad student. I'm not working that much. So $75 a month is kind of expensive for health insurance, okay? They told me in this paper that I got automatically enrolled to the new thing, to the new insurance. I was paying $75 a month. Guess what I'm paying now? Or what I'm not going to pay, but guess what it went up to? $652.32 a month. You got to be out your rabbit ass mind because ain't no way that it went from $75 to $652 a month. That is ridiculous. That is so ridiculous. And I feel so bad for people that have insurance and they have to have a certain insurance to go to a certain doctor to get certain prescriptions and they got to keep this expensive ass insurance. It's ridiculous. It's so ridiculous. That's why we really have to start focusing, like I've been saying, focusing on just staying healthy so that we can have some type of insurance that doesn't cost a lot, but not have to rely on our insurance that doesn't even kick in until you pay your deductible. I don't even have insurance until I pay my deductible off. It makes no sense. I hate the system. I hate the way that it's set up. It makes no sense.
Millions of people are going to choose not to have health insurance in 2026. It's no surprise that everyone's insurance premiums are rising pretty drastically for 2026. And a lot of people just don't want to or can't afford to pay these increased premiums. So they're choosing to save money and not have any health insurance for 2026, which is quite concerning that a lot of people have to make this decision. And it is very upsetting that the insurance premiums have been rising, and the jump from 2025 to 2026 is going to be an insane amount to increase. So I want to hear from you guys. Are you happy about this? Are you upset about this? How much has your health insurance premiums increased from 2025 going into 2026? Take a look at the rest of these stories.
$520.40. That is the tax credits I'm going to be getting towards health insurance through the marketplace next year. Now, let me put this in perspective because you're going to be like, oh, that's a lot. It is, but that's the point. This is why I'm saying this. Y'all need to start giving a shit, even if you are completely healthy, because of this. As many people on my page are aware, I was in and out of the hospital the past year. My income for the whole year was about $25,000 because I was in and out of the hospital. I was bumped down to part-time status and forced to use healthcare.gov. I have nothing against healthcare.gov. I think it's a wonderful thing for people. However, this isn't. And this will, again, affect everybody. So for context, $520.40 is taken off my monthly premium. Yes, that's correct. Taken off. Let me tell you the numbers that I was seeing for even the most basic catastrophic type medical insurance. The lowest one, by the way, I saw that could do anything really at all was $150 a month. So add that $520.40 onto that. That's what y'all will pay. And something I want to put out there too is that there is a major push towards Kaiser, which for the majority of people, myself included, is not a good option, especially if you have chronic illness. But right now, this country is not being led and directed like it's supposed to. It's being treated like a business, and that's a problem. So are we shocked? No. Anyways, for people who don't get the tax credits, y'all are looking at $600 plus a month per person, by the way. And that doesn't include vision, that doesn't include dental. And if you're like, oh, well, I have an employer plan, that's not going to affect me. Oh, yes, it is. All of this bumps up premiums all across the board. It doesn't matter if you're going through the marketplace or through your employer. You're going to see increases on both ends. Deductibles and out-of-pockets out of this fucking world. I'm talking like $7,000, $10,000 for like the least amount. Now you're probably thinking, that doesn't affect me. Yes, it does. Again, yes, it does. Because here's the thing. Shit happens. Accidents happen. Illnesses happen. What if you have to go and like get a surgery? What if your kid breaks a leg? What if your grandmother needs a hip replacement? What if someone in your family gets sick and they need to be hospitalized? Because again, it happens to like the most healthy of people. Y'all are fucked. Y'all are about as fucked as I am on a daily basis. Remember, you have to meet your out-of-pocket and deductible. So, y'all want to talk about EpiPens? None of them want to cover my EpiPens. They don't want to cover my chemo either. It's time to stop not caring and start caring. Because again, none of this ever just affects the minorities. It doesn't just affect the disabled or anything like that, the low income. It affects everybody.
So I just got my 1-year-old daughter's renewal policy documents for her health insurance. We are self-insured because we are self-employed, so we don't get the employer benefits, and she has a child-only policy since I honestly can't even afford to get one for myself. But look at this increase. Yeah. Starting in January, her insurance is going to be $400, and that is almost 47% change from 2025 when it was $272.38. And to add insult to injury, they're also changing the deductible. So that's going up across the board for this plan. So it's more expensive and worse coverage. So I don't know what you guys are seeing out there, but this is just ridiculous.
My health insurance is going up almost $100 next year for the exact same plan. Now, I have a very bare bones plan to begin with, high deductible, not the best coverage, but since I'm my own business owner as a creator, I have to pay all my health insurance out of my own pocket, so cost is a really important factor for me. Which is why it is not so fun seeing that my plan is going from about $300 a month to almost $400 a month. What's sadder is that this is one of the better case scenarios that people are facing right now. Because Trump wants to end the law that keeps healthcare affordable, on average, anyone getting their health insurance from the marketplace will be paying twice as much next year as they paid this year for the exact same plan. Like if you're a 60-year-old couple making $85,000 a year, your health insurance premiums would likely increase by over $22,000. That is on top of what you've already been paying every single year. It is insane. I talk about money all the time online, and the thing about money is that most people don't have tens of thousands of dollars extra to spend on the exact same insurance they were paying before. This is going to financially destroy so many people. It's scary, but it's also downright cruel. So if you've been wondering what all this fight around healthcare is about, this is it. You can look up your own state and how much your premiums will go up this year. And if you care about affordability and healthcare, please be sure to spread the word.
I'm canceling my health insurance. I've made my final decision. I pay $440 a month. I have no past medical history except getting my tonsils out. I pay $440 a month. They want to raise it to like $550 or something like that. I don't get anything done. I don't see anyone. I don't have any specialists. I'm not on any medication besides GLP-1s, which I pay out of pocket. I spend $7,000 a year just in case. Just in case what? Do you know what I could do with $7,000 a year? Times 7, 14, 21, 28. How much money have I been spending? And I know it's like I've told a few of my friends, they're like horrified. They're like, you cannot do that. Especially my nursing friends. They're like, you cannot do that. Why? I'm paying $7,000 a year just in case. Just in case what? Just in case what? Oh, well, you don't want to have to be in debt, charge it. I'm 6 figures in nursing debt. I have my I have my master's in nursing. I'm already 6 figures in debt. You think I'm ever going to pay that off? $7,000 a year. I'm canceling it. I don't care. I pay out of pocket because I'm a travel nurse, so it's easier for me to pay out of pocket because like in between contracts things get weird. Yeah. I don't. I'm in the mindset now. My entire life I've always been like that anticipatory anxiety. What if? I gotta do this. What if? 2026, I decided my motto is gonna be, we're gonna cross that bridge when we get to it. I'll cross that bridge when I get to it. I'm still not old enough to be needing a mammogram or anything like that. I think I can raw dog it for a year, get my shit together, get $7,000, get myself squared away financially, and then re-enroll next year. I think for 1 year, I'll be straight. And if not, I'll cross that bridge when I get to it. That's it.
I just logged into my health insurance provider, and I'm in the same boat as so many people. It's absolutely stunning what just had happened. In June of 2025, my insurance went from $125 a month to now $426.84. And now, since it's open enrollment, it's unbelievable. I mean, I'm at a loss for words. It has now grown to $1,164.82. What am I going to do? How am I going to afford this? Do I have to cancel my insurance? Like, what's the way for Americans to get health insurance? What are we all going to do? I'm broke. I can't afford it. It's a sad, sad day.
Do I really want to pay $450 a month for health insurance that won't cover anything? Going without health insurance is rolling the dice with my health in case, I get in an accident or God forbid something worse happens. And I feel like I'm not alone. I feel like millions of Americans are wrestling with this same exact question right now. Many of them have probably already just walked away and said, you know what, screw it. I'm just going to roll the dice. Other people have said, well, I guess I'm just going to have to pay a bunch of money for something that really isn't good. This is not a quality plan, by the way. This is the cheapest plan that is afforded to me in the marketplace. And I cannot believe it's gotten to this point. And I think we have been completely abandoned by our lawmakers. The shutdown was all about this. And that was what the holdout was supposed to be. It was supposed to be about protecting us and making sure we weren't going to have to pay all this money and lose our health care. But apparently, we were just swept aside. I don't know what to do because I'm leaving the country anyway, but I'm still going to be here for a couple months. This is one of the hardest decisions I've ever had to make, and it's one of the most frustrating decisions I've ever had to make. What did you decide? Did you decide on healthcare for next year? Are you going to go with it, without it? I'd love to hear your thoughts and what you're doing about this situation. It's a tough one. It's a tough pill to swallow, but unfortunately, we're all in the same boat here.
Our health insurance is going up about 13% for 2026. This year, we've been paying $153.15 weekly for our insurance premiums, and next year, it's going to be $175.63 weekly for our insurance premiums. So that's about $700 a month that we're paying, and that's just for me and my husband. On top of that, it's an 80-20 plan, but it's kind of weird because it's HSA, so we have to file, like when we get a bill, we have to submit it to the HSA to get reimbursed, and they reimburse us 20%. So not only are we paying $700 a month, we also have to pay 20% of whatever the bills are. I know health insurance is increasing all over the country, and if you have your own health insurance through like a state program where you have to buy your own insurance, not through an employer, I've heard it's going up astronomically. So I'm thankful that we don't have to buy on the exchange and it's through my husband's employer. But I honestly don't even know what it would be if we were buying our own health insurance on the state exchange. Has your insurance gone up a whole lot also? And I should mention, this is just for medical insurance. This does not include dental or vision. So do you think $175.63 a week is a lot for just 2 adults, or is that reasonable?
I just checked our healthcare coverage for 2026 because we got a notification that it would be changing due to the big beautiful bill. And our insurance premium is 400% more than it was in 2025. 400%. That is absolutely insane. All of the copays also 400% higher than they were in 2025. My husband works for the state, so he gets insurance through his work, but we had to not elect for that insurance because they had passed something through an EO that said that they would no longer cover his medication. So we could stop doing that, and we got the private insurance to take care of that. Then we get a letter from Planned Parenthood, who was the person that he was using as a PCP at the time, that says that we can no longer see them because of our insurance because we got it through the And Better Marketplace. And Better Marketplace is not Medicaid. Healthy Connections is Medicaid. But because it was through the And Better Marketplace that we got our insurance, they sent him a letter saying that they would no longer be able to see him for his appointments because of that. I'll find the letter for you tomorrow and show it to you where it says that, and it specifically says that, the current administration has done this. So I was like, okay, whatever, we're just going to pivot, we're going to find another doctor, it's going to be fine because our insurance still covers all of the medical care that we both need. And then I opened that today to look at and just see what we're looking at, see what we're dealing with, because I knew it was going to be higher, but 400% higher. Our copays went up for everything too. Every single thing under our insurance has copay now. And these are not low copays. We're not talking like $10 or $20 or $15. Like, no, we're talking $50, $150 copays. That is fucking insane. Fucking insane. And I don't know what we're going to do, because we both take medication that we need to take to stay alive. To stay alive, we have to take the medication. And without insurance, medication that I take alone, one of them is $830 a month. That same prescription, Hunter also takes it, which is also $830 a month. That's not even counting the 2 other medications that we both take. The total cost for our medication is somewhere in the realm of like $3,000 a month. And this isn't just our story. This is not just an us problem. So many people that are worse off than we are. And my heart breaks. My heart breaks for them. My heart breaks for everybody, because I don't know what we're going to do, and we're okay. And I can't imagine what it's like for most other people that aren't as fortunate as we have been blessed to be. This is insane. It is so insane. And I'm so sorry that this is the world that we live in right now, that people are debating over whether or not people deserve to have food or health care or access to the things that they need, to these basic human rights. I'm so sorry. This is the world we live in right now. I love you guys. Take care of each other.
Health insurance costs are going up by a lot. But what exactly is driving that rise? So according to experts at Johns Hopkins School of Public Health, there are several key factors that explain what's really behind it. So one major reason prices are going up is because certain government discounts, called subsidies, are ending. And these subsidies helped millions of people pay for their insurance plans. And when these discounts end, the monthly price of insurance can jump by 25 to 30%, which means many people may no longer be able to afford their coverage, unfortunately. Another reason is that the price of medical care itself is just rising. And so, not because people are going to the doctor more often, but because hospitals, clinics, and other providers are charging more for the same services. So, like your checkups, your tests, and your procedures. And so, when the cost of care goes up, insurance companies raise their prices as well. So, third thing, there's also a concern about who buys insurance. Insurance works best when both healthy and sick people are in the same group. But if younger or healthier people drop their plans because they're too expensive, the group becomes mostly people who need more medical care, essentially. And this makes insurance more expensive for everyone who's left over. The fourth thing, even people who get their insurance through their job are feeling that rise in health insurance as well. So some employers are now paying tens of thousands of dollars each year to cover just one employee. And when companies pay more, workers often pay more as well. They pay more in premiums, deductibles, and in copays. Number 5. Lastly, the way that the U.S.'s health system is set up plays a very big part in this as well. So prices are influenced by deals between hospitals, insurance companies, and drug companies. And the process is fairly complicated and not very transparent, and hard for everyday people to understand or to even challenge that process. So experts say that real change would require big decisions like whether to reform how subsidies are given or how employers and insurers negotiate healthcare costs. So essentially, the rise in health insurance costs isn't about people using more healthcare. It's mainly about the end of government discounts, higher prices for medical services, fewer healthy people staying insured, and problems built into the system itself. The more we understand the issue, the better we can advocate for policies that help people essentially stay healthy without going broke.